Okay. Welcome, everybody, to the first budget hearing of the Health and Social Services Subcommittee of Appropriations. Glad to have everybody with us for this kickoff of the 2023 budget. We will begin today with the Office of the Maryland Commission on Civil Rights. With us today are the Executive Director, Mr. Alvin Gilliard, Mr. Cleveland Horton, the Deputy Director, and Ms. Nicolette Young, the Assistant Director. I am going to turn it over to the Budget Analyst to present his analysis, and then the department can respond with their presentation. So we'll turn it over to Sam and go from there. Sam, do you want to share the analysis while we're going through it?
Yes, I will share my screen. Just one second. All right. You should all see the budget analysis on your screen. Good afternoon. My name is Samuel Quist. This is the budget for the Maryland Commission on Civil Rights. The fiscal 23 allowance is $3.9 million, which is a slight increase, about 0.5% over the fiscal 22 working appropriation. Exhibit 1 on page 2 of the document, as you can see, the majority of the allowance is for personnel expenses, 89%, or about 3.4 million out of the 3.9 million total. This supports the agency's 33 regular and 1 contractual staff position. The next page, Exhibit 2, this shows the major changes in the budget. Again, most of the change here is in the personnel category. This increases by a total of $168,000, with the main increase being in the health insurance expense category. The 2 main decreases in the budget relate to one-time expenditures in fiscal 22. There's a $95,000 decrease in special fund revenue for the civil rights event and other outreach activities, as well as a $70,000 decrease for replacement information technology purchases. The governor's budget proposal includes a $99,000 deficiency appropriation for FY22, so those expenses partially correlate to this decrease for information technology equipment purchases. Moving on to the key observations section of the document, as part of its annual Managing for Results submission, the Commission includes data on several performance measures related to its complaint and complaint processing. Exhibit 3 on the chart in front of you shows the number of inquiries and complaints that are received for processing each year. And the chart shows a decline in fiscal 2021. The Commission indicates that this is partly attributable to some impacts of the COVID-19 pandemic, especially in the area of employment, which in each year is typically the largest share of complaints received. And the reason behind this can be related to the increased number of individuals working from home in the past year, which has led to less workplace incidents occurring as a result. Exhibit 4 on the next page shows a similar trend. This chart is the number of complaints closed per year, and it's broken out by each of the different categories. So the blue bar on the chart for employment, the red is for housing, which did show a slight increase in fiscal 21, and the green is public accommodations. Public accommodations also decreased. Since these cases relate to public accommodations and public spaces, there are some impacts related to the pandemic as well regarding access to those areas. Exhibit 5, the next chart, this is the MFR reporting on the case processing timelines. This gives the average number of days per each case type. For employment, housing, and public accommodations, the employment cases averaged around 364 days. Housing was 200, and public accommodation was 365. These have been increasing the past several years, but as you can see on the chart, the rate of increase was slightly greater in fiscal 21. During last year's legislative session, the same topic came up, and as a result, the subcommittee requested that there be committee narrative included in the joint chairman's report. The commission submitted their response, a report in September of this year, which provided some additional detail on the number of cases pending, the current investigator caseloads, and some other details regarding staffing and factors impacting case processing times. This report indicated that at the end of fiscal 21, there were about 896 cases that were currently pending. As far as the investigator case loads, these varied depending on a couple different factors: the unit that the investigator was in, their experience level, the complexity of the cases involved. But the commission had determined that there was a maximum workable caseload number per investigator, and for good reason, I think, for maintaining that each case was given adequate attention and thorough investigation. However, that, along with some staffing constraints, was cited as the main reason for these increases. The report, as asked for by the subcommittee, also requested information from other jurisdictions with similar sized caseloads. And as a result of the outreach that the Maryland Commission on Civil Rights did in that respect, they reported in their submission that other jurisdictions and other states were seeing similar issues in this respect, and were having average case processing timelines for all cases between about 270 to 165 days, which is kind of the similar amount as shown in Exhibit 5. As a result of these continued increases, the Department of Legislative Services is again recommending this year that the subcommittee request committee narrative in the Joint Chairman's report, asking for a update as of the end of fiscal 22 with similar data on the number of cases pending at the end of the fiscal year, as well as other information on investigator caseloads or any other factors impacting staffing that may be impacting these numbers. That concludes the DLS presentation, and I can take any questions at this time.
Wonderful. Thank you, Sam. Does the committee have any questions for the analyst before we move on to the department? Okay, seeing none, let's move on to the department. We'll start with Director Gilliard and Deputy Director Horton and Assistant Director Young. So please, whoever wants to present your report and your response.
Great. Good afternoon, Chairperson Resnick and members of the House Health and Social Services Subcommittee. I'll be brief, but we do want to thank you for this opportunity to respond to the Department of Legislative Services fiscal year 2023 budget analysis. We'd also like to thank our assigned analyst, Sam Quist, for his thorough analysis. As has been the case in recent years, this spending plan presents challenges for the Maryland Commission on Civil Rights. We've worked creatively and consistently to respond to our greatest challenge. And we believe our greatest challenge is accepting complaints of alleged unlawful discrimination and investigating them in a timely, fair, and professional manner. We've reduced cases that were in unassigned status as of September 1st, 2021, from 567 cases down to 287 cases. And while this clearly represents great progress, it does impact the individual caseload of each investigator. And this increases the likelihood of cases not being immediately put into assigned status. However, notwithstanding these challenges, MCCR requests the subcommittee's support in concurring with the governor's allowance for MCCR in fiscal year 2023 budget. And we thank you and are happy and prepared to answer any questions you may have.
Thank you. Thank you very much for that presentation. Seeing a question from Delegate Henson, please go ahead.
Thank you, Mr. Chairman. Thank you, Director Gilliard and your team for being on today and making your recommendation on the budget. I want to just start with the context of the very important work that your agency does. When we have people who are experiencing housing discrimination, being denied for various factors that are within the protected classes, your agency is where they go to seek relief to make sure that they can have a roof over their heads. When we have people who are seeking public accommodations that may be persons with disabilities and they're not able to be accommodated when they are traveling to our state or within our state, your agency is where people go for help and relief with that. When we have persons that are harassed on their job, wrongfully terminated for all of the reasons that are protected, your agency is where people can go to seek relief. So the work that you're doing is incredibly important, and it really intersects with so many things that keep our state vital and functioning. So thank you for the work that your agency is doing every day. I wanted to better understand the relationship between staffing and the case processing times. Looking at the analysis provided by Mr. Quest, it looks like the amount of inquiries and complaints has declined sharply. But in 2020, the increase in processing times went in the other direction. I'd like to understand that.
Thank you. And I'll defer and ask Mr. Horton, our Deputy Director, who is in charge of our case processing unit, if he would respond.
No problem at all. And thanks for that great question, Delegate Henson. And one, thanks for recognizing the important work of our agency. So when we talk about staffing, we've had over the years an issue with staffing turnover. So when you take a look at our staffing, even though we're averaging about 12 investigators over the last 5 years, that's a combination of constantly losing individuals and having to replace them with new staff. So you know that when we get new investigators, they have to be trained, they have to get up to speed. So what happens in the interim, cases begin to age. So although you may see, as you pointed out, that our number of inquiries are going down, there still results sometimes in a processing time going up because we have new staff and we're trying to get them up to speed to be able to address the complaints that we do have. So that's why you see the difference potentially in the decreased inquiries and the processing time still going up.
Thank you for that. The recommendation from Mr. Quest is that you all at a later time comment on the staffing challenges there and identify some reasons on why that is the case. Do you have any early or preliminary thoughts on what's the driver behind keeping staff and recruiting staff?
Sure. So, and again, another great question. So what we've dealt with, if you take a look at back in fiscal year 15 and 16, our agency doubled our intake number. So we went from approximately in fiscal year 15 having 518 intakes to having 996 in fiscal year 2016. Our agency literally has been trying to rebound ever since then. So we doubled in the amount of work, but we haven't doubled in the amount of staff. So what has happened is our caseloads for our staff have swelled beyond reason. So when we take a look at our staff who is constantly being recruited by other companies and agencies for higher pay, less work, we've had a difficult time as an agency keeping staff. That's why we took the leadership decision to try to reduce the caseloads for our staff, because we recognized that we were burning our staff out at both ends of the candle. So we really tried to make sure that we had much more manageable caseloads. But in order to do that, we had to create the backlog, which we now have. We are trying to address the backlog, but we also want to make sure that we're treating our employees fairly and then make sure that they're actually able to get the work done. We think about complaints coming in, as you acknowledge, whether it's a public accommodation, housing, or an employment case. It doesn't do anyone any service if we just assign it to someone and it just sits in that caseload. So we're trying to do our best to make sure that we are addressing complaints as fast as they come in, but we also want to make sure that our staff has the appropriate caseloads to make sure they can investigate each case thoroughly to make sure that we're making the right determination in each case. So when we talk about struggling from a staffing standpoint, it's really been the swelling of our caseloads and our staff being pulled to other agencies and companies to do less work for more money. And we've struggled trying to retain great staff that we've had over the years.
Thank you, Deputy Director. I'll look forward to the opportunity to explore that more at the appropriate time. Thank you, Mr. Chair.
Thank you. And I just wanted to add my thanks to you, Mr. Horton, for the efforts that you all are taking to not burn out your staff. The example that you are giving of caseloads going up, burning people out, and then moving over to other positions for more money and less work is actually been a problem across departments. And so it is a problem we will hope to try and address this year and in years to come. But thank you for at least thinking about your employees in that fashion and working with them to try and keep them, happy in their work.
I appreciate those comments, Chair Resnick.
All right. Any other questions for the commission? Seeing none, I don't believe we have any witnesses signed up. So I want to thank you all for coming out and presenting to us today. And now we will move on to the next budget, which is the Maryland Department of Health's Office of Healthcare Quality. We're going to turn it over to our budget analyst, Andrew Garrison, for his presentation, and then move to the department for their presentation and response. So Andrew, go ahead and share your screen and take it away.
Wonderful. Thank you, Mr. Chair, members of the committee. In front of us today, we have the Office of Healthcare Quality budget. You guys should be seeing my screen that has that in front of you. And what I want to highlight at the start here is that we're looking at about a $30 million budget, and it's actually showing a $4 million increase here in the fiscal 23 allowance. And what's really driving that overwhelmingly is an increase in personnel expenditures that we have budgeted here. And so that's what we're going to be talking about a lot of for the hearing today. And to get things started, we're going to actually move to Exhibit 2, where we have those personnel expenditures broken up right away. And so of that $4 million we're talking about on increase here, we can attribute nearly half of that, $1.8 million of it, to a reduction in turnover. And so as you all know, but as maybe some folks at home don't, the turnover adjustment is something that happens in the budget process that accounts for any sort of vacant pins or if someone leaves their job, the amount of time it might take to hire someone into that position. What it is, it's a negative adjustment to salaries that we have in here. The salaries are obviously put into the budget on an annual basis. So at any time someone's not in a position, they're not using that dollar to pay that salary. So we have a turnover adjustment in there. Last year in fiscal 22, this budget had a turnover rate of about 9%. So again, anticipating about 9% vacancies at any given time. And that was a negative adjustment of the $1.8 million that we're seeing here. What has happened this year is the turnover adjustment is 0% and $0, essentially saying that at any point in time during the fiscal year, all of the positions in the Office of Healthcare Quality will be filled. And we're talking about 230 individuals for this budget, which is a big ask for any agency. And as we'll talk about a little bit more, is a bit out of step with what some of the historical vacancy rates have been. Some additional increases that you see here are about $500,000 for new employees. That's going to be the salaries for 10 new positions. They're the third line. And what that was is from the Maryland Nursing Home Protection Act of 2018, Chapter 454, that you guys had passed that mandated 10 additional employees in each subsequent fiscal year. We're in year 4 of 5 of that. And then additionally, you guys did pass legislation as well now 2 years ago 572 and 576 of 2020 that adjusted the salaries and had increases for different healthcare personnel throughout the health department. We're seeing about $1 million in that budget, in the budget to increase that as well, which is that second line. And that is really what's driving a lot of our dollar amount changes that we're seeing here. To turn back to the discussion of turnover and the vacancy rates, what we have here in Exhibit 3 is the historical vacancy rates for OHCQ. As I mentioned, the budgeted turnover, so what is being forecasted or planned for in fiscal 23 by this budget is that there will be, all the positions will be filled throughout the entire fiscal year. Right now, we're looking at a vacancy rate of 18%. That's going to be about, I think, 40 vacant pins that we have currently. And it's not uncommon for this agency in particular to have a fairly low vacancy rate. We see back in May of 2020, they actually were able to fill a lot of those positions. However, it has increased significantly since then. And frankly, the current vacancy rate does not suggest a turnover of 0% is necessary or really reflects what this budget's actually going to spend. So DLS is recommending a increase in the turnover rate up to 5%. And what that would impact is about $1 million cut to this agency. However, as I mentioned in fiscal 22, the budgeted turnover rate was actually at 9%. So this is still much lower than what that was, still in, I think, in spirit and in step with what the governor and the agency wants with this turnover adjustment, still allowing them some additional flexibility, being, I think, very optimistic in terms of what they will actually spend on their personnel expenditures. It would actually be about $800,000 above what was budgeted in fiscal 22, but perhaps a little bit more in line with what we think the actual dollar amount is going to be here. The other thing that I do want to discuss that is a staple of this budget is talking about their ability to complete some of the annual surveys. Of course, OHCQ is the unit of the health department that's tasked with doing surveys of various healthcare facilities, nursing homes, developmental disability units, and assisted living facilities in particular is what we're going to be talking about. The nursing home surveys are being done by the long-term care unit, and that's what we're showing here in Exhibit 4. There are statutory mandates for this unit to be conducting 100% of annual surveys for nursing homes each year. And as we show here, that's something that they haven't been able to do. But we do want to highlight that in the last couple of years in particular, there's been an additional workload placed on them by COVID, particularly the focused infection control surveys were something new that was established by CMS, looking to reduce transmission of all diseases, but obviously came to the fore during the pandemic, and that has increased their workload. And then that survey mandate has decreased, particularly for this unit, or the meeting that mandate has decreased. But we do see similar trends in units that were perhaps less acutely affected in their day-to-day work by the pandemic, including the developmental disability surveys, as we show here in Exhibit 5, and also in the assisted living units. Although those are creeping up, they're still not at 100% where we would expect and is mandated. This was also a finding of the Office of Legislative Audits. My colleagues there pointed out as a repeat finding, again, that that OHCQ here is kind of routinely falling short of what's required. The last thing, a little bit earlier, I mentioned that there was a mandate in place for 10 new positions. I wanted to show where those have been distributed, and with some particular focus to some of those units and survey activities that have had more challenges in meeting those survey mandates. Each year since you all passed that Nursing Home Protection Act, we have the governor's budget has met the requirement there. Next year will be the last year of that. It will have added 50 pins to the agency in subsequent fiscal years. And in closing, just again, our recommendation here is to increase that turnover rate from 0% up to 5%. It's about $1 million reduction, and it's distributed across personnel expenditures relative to funds, so disproportionately in general funds. That concludes my presentation, and I'd be happy to take any questions.
Sounds good. Andrew, why don't you keep this up for a minute? Because I have a couple questions, but I want to see if anyone else has any questions for you before I ask. Not seeing anyone. All right. So can you roll back to the original summary chart with there it is. Okay. So just so I am clear, there's an 18% vacancy rate right now. That's about 40 positions. There is a addition of about $500,000 for 10 new positions. So they're actually looking to fill 50 positions. Is that correct?
Yes.
And tell me if my math is wrong and I'm missing something, but they've budgeted $524,000 for 10 new positions.
Yep.
Those are supposed to be nurses.
Yeah.
So they want to pay nurses $50,000 a year and change.
Yeah, there's probably some additional benefits that aren't captured in that number, but more or less, yeah.
So they want to fill 50 vacancies this year, trying to hire licensed nurses at about $52,000 a year.
Yeah.
I can't imagine why the vacancy rate is so high. All right, thank you so much. I appreciate it. Any other questions for Andrew? All right, seeing none. Let's move on to the department. We will have Secretary Dennis Schrader, Deputy Secretary Jinlin Chan. I'm sorry, I totally mispronounced that. Chief Financial Officer Amalia Brandenburg and Assistant Secretary Webster Yee. Mr. Secretary and your team, please take it away.
Mr. Chairman, committee members, thank you for having us today. As you mentioned, I'm joined by Dr. Jinlin Chan and our CFO, Emily Brandenburg, who's just come to us from a tour of duty with the Maryland State Department of Education and previously was with the Anne Arundel County organization. And then we also have, in addition to Mr. Yee, Nick Napolitano, part of the staff to answer questions. We're looking forward. This is our first hearing. We're going to have many of these hearings for over the next 45 days. We're looking forward to that. And I'm going to ask Emily to address the initial questions in the DLS report, which we thought was really excellent. The department wants to thank the governor and DBM and the budget committees for their support over the last couple of years, which, we don't have to tell folks how hard it's been for everybody. And we thank Legislative Services for their budget analysis, which was very insightful. So I want to thank you all again. And I'd like to turn it over to Emily Brandenburg to go through a few items. Emily?
Thank you, Secretary Schrader. For the record, I'm Emily Brandenburg. I'm the CFO for the Maryland Department of Health. In response to DLS's recommendation to increase the budgeted turnover for existing positions to 5%, the department respectfully disagrees and supports the governor's allowance. We do have additional supporting details for our position, which can be found in our written response. And with that, we're happy to answer and entertain any questions.
All right. With that in-depth response, are there any questions? All right, we'll start with Delegate Vice Chair Valentino Smith.
Thank you, Mr. Chair. Thank you, Mr. Secretary. I know you and everyone at the department have been on overload with the pandemic and the demands that it's placed and your very apparent shortage of resources. I have a question. You can go to page 6, but so look, for the years that I've been here, you guys have been, for whatever reasons, unfortunately, woefully behind in your site visits. And I think Delegate Resnick was pointing to that too. I mean, really 2 questions, like how far are you reaching out to recruit the nurses that you need? What kind of competitive salaries are you using? Are you reaching out with the tuition reimbursement tools that we put in place, or tuition forgiveness tools that we put in place? How aggressively? I know nurses, there are not enough right now and it's difficult, but are you using that? And then with respect to your on-site surveys, clearly during the pandemic, it looks like for community-based providers and developmental disabilities providers coming in and the new providers, and most of them, you had to switch to an online audio-visual visit, and you had to kind of have them tour the space by carrying the cameras around and asking them to point them for the purposes of the survey in different directions. And while I understand that that was a result of the pandemic and something that was better than nothing, I have concerns about the recommendation that says that this type of survey is now being incorporated into OHCQ's standard processes when appropriate. So last year I worked on a bill with respect to nursing homes where the state took a very strong stance that said, and it looks like here it says you were using them with new providers coming in, that for new providers coming in that did not have a history of having provided services in Maryland, that it was almost essential that you get on site and look at them because you have no history of that particular provider. And whether or not the provider was operating for profit or not for profit, because the goals and the systems had changed that we had seen when we had outside providers come in, that they might not be pushing all their money towards quality of care. And there were concerns about patient safety. So overall, I guess the question is, how much do you intend to continue if the pandemic, is subsiding, to make it standard of practice to just use visual cameras for on-site surveys for new providers?
Thank you, Madam Vice Chair. I'm going to ask Dr. Chan to address those two questions. Dr. Chan?
Thank you, Secretary, and thank you, Chair Resnick and Delegate Valentino Smith. For the record, again, my name is Dr. Jinlene Chan. I'm the Deputy Secretary for Public Health Services with the Maryland Department of Health. So let me take, Delegate, your first questions first regarding our recruiting strategies and the work that we're doing in terms of the salaries and such. So we are actively looking at every tool to fill vacant positions, and Dr. Ney, the director of OHCQ, is always pursuing every option possible. In addition, the current salary range for these nurse surveyor 1 positions goes from about 54,000 up to just shy of 90,000. And with the proposed ASR that the Department of Budget and Management has put forth, there will be an additional 1 grade increase for, I believe, all nurse classifications, which would also, of course, impact this particular group of individuals and staff. And so we are looking forward to using that additional salary to be more competitive in the market and be able to not only hire, but to retain staff. As you are aware, even with new hires, individuals for these very detailed, the detailed work that they do require about a year's worth of training before they are certified to operate independently, if you will, and so require training, oversight, and additional monitoring from our existing staff and supervisors who are already certified and experienced. With your second question, in terms of virtual surveys, so we are still within a pandemic, as you know. We are seeing increased cases while they are decreasing overall, and we look forward to that slope continuing to trend down. The staff have, of course, over the last 2 years modified their approach, but have been going out and doing on-site surveys. The use of virtual surveys would be limited. And again, staff are even now out in the field and doing on-site surveys. And I think that the use of the virtual surveys would be limited and perhaps for routine purposes. So thank you.
Thank you. So if you just have a developed policy internally for the application and the use of those, just send it. That would be helpful. And then just in closing, Mr. Chairman, I think you really need to contemplate aggressively going out to these nursing schools and figuring out how to give tuition and tuition reimbursement to start recruiting your nursing staff. It sounds like each department is doing something different with respect to recruiting. And maybe you need some consolidated effort, but we did offer some kind of tuition reimbursement, and I don't hear anyone saying that they're getting success using that. So I hope that that's a tool that will help someone to forego debt to come work with the state. Thank you.
Okay, Delegate Henson, you're up next.
Thank you, Mr. Chair. Thank you, Mr. Secretary, for the presentation. And you touched on it just a little there, but I would like to understand, we have in the budget currently is nearly 2 million for the turnovers. And then what we're being asked to do, or the recommendation from the analyst, is that we reduce that by almost half. So I'd like to understand the plan, the strategy for mobilizing that money to result in more employees. I know that you touched on using every tool possible and every option that's possible, but I'd like to flesh that out a little bit more and to understand the programming for that money.
Thank you, Delegate Henson. I'm going to ask our CFO, Emily Brandenburg, to address that plan.
I'm sorry, I am trying to get off mute. The governor's budget, as it's introduced, focuses on maximizing our ability to hire qualified employees and to retain the personnel. So by increasing the budget at turnover, as you alluded to, for existing positions to 5%, the DLS recommendation creates an artificial budget limit on hiring personnel. And the number of trained surveyors directly relates to the amount of oversight of the facilities. Fewer surveyors will result in less oversight of the quality of care provided at healthcare facilities. Fewer surveyors will decrease the number of surveys in nursing homes, assisted living, developmental disabilities, as well as many other industries. As Dr. Chan alluded to earlier, it's all hands on deck for our recruitment efforts, and we certainly don't want to limit the capacity for these teams to be hired.
Thank you for the response. What I'm looking for, and maybe you could respond at a later time, is more specificity. $2 million seems like an awful lot for targets of every tool possible and every option possible. Perhaps understanding the strategy for recruiting could give us more, if we were able to be better partners with trying to figure out how we can drill down on those recruitment strategies and be able to assist through policy or budget or whatever means possible. But that's really difficult without having something that says how $2 million will be mobilized to equate to more employees, particularly when there's been longstanding issues with vacancies and staff. So if this is not the appropriate time, I would look forward to it at a later time, understanding a specific strategy better. Thank you. Thank you, Mr. Chair.
Delegate, if I could add a couple of points, and I wanted Deputy Secretary Chan to speak on this also. We have had a history up until the pandemic of a 3% and sometimes even lower vacancy rate, to the point where, these are very attractive jobs, particularly for nurses who want a respite from the bedside and learn some additional skills. So in the past, recruiting was not difficult. So what we have to do, and Dr. Chan may want to address this, is to find out, okay, what have been the barriers? We think raising the salaries will help with this. And we also want to figure out, where are the barriers that, because of the pandemic, the workforce has been pretty worn out, but these are attractive jobs, and we've not had problems until the pandemic in recruiting. Dr. Chan, did you want to follow up on that? Because I think the delegate's asking a very good question.
No, I agree. And, I think that we're all in a position where we're looking at, the market and the workforce itself has changed in the last 2 years, as, we have seen the challenges across, anything related to healthcare, as we speak with our partners in the hospitals and nursing home industry, among others, in terms of their ability to fill critical positions in a way similar to ours. However, even with the 10 positions, for example, that we received this year, 7 of them have been filled, and we anticipate soon filling the other 3 2023 with the next recruitment. And so again, I think this is attributable to the aggressive recruiting strategy that Dr. Ney continues to implement. And, you know, as you saw in the budget analysts documents, and I appreciate the detailed analysis there, you know, we have gone down below 5% vacancy, and it's bumped up and down in the last 2 years. So our goal, of course, is zero vacancies, of course, but it's always a challenge. So we're trying to grapple with that.
And if I could add one last point, Delegate, as we analyze the market, we are also competing with the nursing homes and the hospitals. And because so many people have left, we did an analysis of licenses with the Board of Nursing over the summer and found there were like 41,000 individuals who were either retiring or didn't plan to renew their license. And we called a number of them, and they said they were leaving or they weren't coming back. So this is because of COVID and the workforce being very weary, they're dropped out. But the other thing that's making the market very difficult is because of the workforce shortage, the nurses that are contract nurses that are being hired by the nursing homes and the hospitals are incredibly expensive. And, you know, our ability to compete with that is minimal. So we have to compete on other things. We have to find people who are looking for career change and are willing to come work for us. And that's part of our strategy. So we'll have more for you on that, but thank you for that question.
Okay, Delegate Young.
Thank you, Mr. Chairman, and I'll try and be brief. One comment before my question was, I've done this privately, and I'm just going to bring this up publicly now because the delegate before brought up about specifics to your recruitment strategy. Tufts University has a robust and well-known nursing program, and before the pandemic, when they would come down here and we would talk with them, I can tell you that none of the nursing students that came into my office or their advisors knew that they could get potential reimbursement for education payments. So I'm just letting you know that they were unaware. A potential pool of folks that could fill some of these vacancies were unaware of some of the benefits associated with joining the state. So my question is specific to long-term care facilities. This has already been brought up. We're talking about it. It's a theme related to your staffing numbers. My understanding is that there's a deficit of 25 surveyors, maybe specifically related to long-term care units, keeping in mind that a very large number of deaths during COVID-19, while we're still in the pandemic, have occurred in these long-term care facilities. Can you speak to the unit? Can you speak to how that 24-person deficit, 25-person deficit has impacted your ability to survey and keep these organizations and the facilities within code and within standards?
Let me start on that one, Delegate, and then I'll ask Dr. Chan to pipe in. As you can see in the long-term care unit chart, our major focus has been for 2 years now in the nursing homes, infection control. Unfortunately for nursing homes, they have a history of doing some level of infection control, but this has been unprecedented. So we are in there frequently looking at their infection control procedures. That's a major challenge for the industry in the COVID era from where they were before. So that is an area that's had a lot of attention, and I'll turn it over to Dr. Chan to add to that.
Thank you, Mr. Secretary and Delegate Young for that question. So just to piggyback on the Secretary's response, and this is alluded to, of course, in the budget analysis as well, but during the pandemic, CMS actually changed the focus of the work of the nurse surveyors and that team entirely to really focus on the infection control. And so they actually put out a brand new survey type, which is the focused infection control survey. And so our teams really focused on that over the last year or two to make sure that the issues that were impacting residents within those facilities, particularly related to COVID, we absolutely know, and the secretary and I look at these numbers every single day, and this has been the top priority for this administration all along, is to prevent nursing home related deaths attributable to COVID and to other issues as well. So I would say that the work of that particular unit has shifted somewhat to focus on the infection control components of it in conjunction with the other teams that are working around the clock at MDH. But in addition, they're continuing to work in the nursing homes for other matters, so complaints, investigations, and other surveys as well. So there is an impact, of course, when we have vacancies, but I think that with the work being shifted, again, we're really focusing and prioritizing that work to make sure that safety and health are continue to be the major priority.
Sure, and as they should be, and your dedication as well as the secretaries to making sure that we're doing this. So being flexible within your resources, I get that. Maybe we can talk offline, or you can respond something specific about how you believe in your position, even with the focus and the shift in focus. A 25-person vacancy would have a significant negative impact related to your surveying of these facilities, especially after we just heard from your CFO talking about less money equals less positions, but you already have 25 less positions with surveyors. So Mr. Chair, if I could just ask one last question.
Please.
Last question being, and this is specific to, I guess, the assisted living facilities. And I'm bringing this up because I've had colleagues talk to me. There's a bill specifically related to facilities that have 9 beds or fewer. And my understanding is that there are 1,200 or plus of these in the state. And I'm not trying to downplay the need for assisted living facilities, and knowing that we need to meet this need as the population gets older. My concern is that, especially with staffing issues, and these facilities being smaller, if there's a way, and they might need to offer this offline, if you could potentially provide for us what common violations you're seeing, what common concerns you're seeing from these facilities, especially since there's so many of them. I don't know the answer to what number is enough. It did surprise me that we had over 1,200 of these facilities, which would absolutely strain your all's ability to survey them and make sure that they're staying within standards. So it's sort of a question, but also a statement related to violations with these facilities. Are you having trouble with the number of them being surveyed, with also having these staffing issues? If you could talk to that, I'd appreciate it.
Yeah, on the second point, or maybe it's the first point, the bill, we'll have Heather Scheck circle back around with you to have a discussion. And then I'll ask Webster if you would add some background to this issue.
Absolutely. And Delegate Young, with assisted living, for example, in the past year, OHCQ licensed 164 new assisted living programs and investigated 1,192 complaints and incidents. So they're absolutely getting out there, especially with the smaller units. They're definitely focused, in the most recent round of 10 new positions. Of the 10, 2 of them were assisted living surveyors. So this is very much an item on our priority list. We're working through them, and we're trying to ensure that on the assisted living side, that it's not just COVID all the time, but again, it's one of our focus items.
And making sure that we know, and being surprised at how many we have, that we're playing our role in making sure that we're doing everything we can. If there is an issue, that we're catching it early and not trying to react to everything. So thank you for the time, Mr. Secretary, Mr. Chairman. Thank you.
Thank you.
Thank you, Delegate Young. I have a few questions, but I want to go to the committee, see if there's anything else from any of the other members. Seeing none. So, Mr. Secretary, I want to raise a concern that I have, judging from everything that we have heard today, In addition to the vacancies, we're looking at 40 vacant positions, 10 additional positions being added, 7 of which you said have already been filled, or I believe Dr. Chen said we have already been filled, which I find interesting that we are filling new positions before we're filling vacant positions, but filling positions is filling positions. The analyst report shows how far behind this department is in the surveys and other work that you are doing. So with that many vacancies being filled at $50,000 a pop, which you admit you cannot compete with the hospitals and nursing homes in filling those initial positions. As far back as you are with all the work that needs to be done, I am surprised and disappointed that after a very successful 10-year relationship with Montgomery County, where Montgomery County was contracted to do their own recertification of long-term care facilities and investigate the complaints that have been filed through the county HHS department. In June, the MOU was not renewed. I'm seeing in the budget analysis a negative deficiency of about $600,000. And I have seen very little in terms of a reason as to why that MOU was not renewed when the county itself has been very successfully doing that work for 10 years, the largest jurisdiction. You're putting that the burden of the work back onto your department, which is clearly already behind in the rest of the state. It makes no sense that you are adding $2.5 million or $2.3 million in staffing while taking back $600,000 to give yourself even more workload. It makes no sense. And I would like to understand. In fact, Secretary Brinkley himself told me that it made no sense to him and that he was inquiring as to why the MOU wasn't renewed. So I would like to get an understanding of why the MOU wasn't renewed and what we can do to possibly reconsider that situation to take burden off of you, to allow you to be able to catch up with this additional staff.
So thank you, Mr. Chairman, and I actually agree with you. This has surfaced to my attention, and I'm doing a review of the decision. However, there is one thing that, and maybe you can help us with this. CMS is requiring us that when we do this kind of MOU, the individuals can't just stay in one county. They have to rotate for legal reasons. And what we've offered, and apparently there was an impasse. So that's why I want to revisit this. But I think we should have them. But what where the deal will have to be is that the people that Montgomery County provides us will have to be willing to rotate to other counties. Not to say they got to go out to Western Maryland or Eastern Shore, but at least rotate into Prince George's or Anne Arundel, Howard, Frederick. So they're getting a more wider experience. And this is a CMS requirement. So I'm more than willing to revisit this, and I think it makes a lot of sense. But there has to be some give and take.
Well, I will let the county HHS department know that if they are not watching this today, I'm sure they are, but if they are not, I will engage with them on that. I will also let you know that I am in fact drafting legislation that would assist in this process. So I'm hoping we don't have to deal with it and we can just find a solution. And then go from there. I'm hoping that Montgomery County knows the regulations from CMS just as well as everyone else. I can't imagine they have been misinterpreted in that way. So let's keep working on it. I hope we can find a resolution. I think it's to not just Montgomery County's benefit, but it's to your benefit as well. And we can find a way to move forward. So thank you for that.
No, I agree with you, Mr. Chairman, and thank you for pursuing this.
All right. Are there any other questions? Also, just to let everyone know, just like the previous budget, I don't believe there are any additional witnesses signed up for this budget as well. So given that, one last take for questions. Seeing none, This concludes the budget hearing for today for those two departments, those two budgets. I want to thank everybody who joined us today. Thank you, Mr. Secretary, and your staff. We will be seeing plenty of you in the coming weeks in the
Yes, sir.
with the other budgets, and we look forward to getting through what is a both a challenging and very prospective looking budget. I'm encouraged by it as well. So thank you to everyone, and meeting is adjourned.